The whole nurses eat their young thing, it's not just a saying, it's very, very real. Nurses talk a lot about how toxic the nursing culture can be. The bullying, the burnout, the eye rolling when a student walks onto the floor. If we want to fix that, I feel like we need to start at the beginning, and for most students, it starts in clinicals. Way too often, students get assigned to a nurse who didn't volunteer, who wasn't trained to teach, who isn't being paid for it. What the students learn, whether it's being said out loud or not, is that they're a burden, that they're in the way, that they're just like an extra task that needs to be completed for the day rather than a future colleague. And I'm not saying that nurses don't care. I'm saying that nurses are drowning. And then we hand them a student with no incentive, no compensation, no extra support, and just expect them to be kind and patient and also educate on top of everything that they have already going on. That's not mentorship. That's exploitation of the nurses. What if we actually compensated the nurses who precept students with money? What if training students was something that people were excited and proud to do instead of being forced to do? Students would be able to learn in a safer environment. Nurses would feel respected for the time and energy that it takes to precept a student, instead of creating more generational trauma throughout the nursing profession. We'd be passing down actual skills, actual competence, actual support. If we want to fix this problem, the burnout, the culture, we have to start by valuing the nurses who teach. Because right now, we're asking them to pour from an empty cup. And it's not just hurting the students, it's hurting everybody. It's not just hurting the students, it's not just hurting the nurses, it's also hurting the patients. We can and we should do better.